Good afternoon and welcome to 3 o'clock with SOC. I'm Marisol Diaz, Communications and Digital Manager. Give me a second while I welcome our Spanish-speaking neighbors. Buenas tardes, soy Marisol Díaz, gerente de comunicaciones digitales y bienvenidos a 3 en punto con SOC. Si quieren acceso al programa en español, favor de marcar el número que aparece en la pantalla, que es 646-749-3122 y cuando le contestan la llamada, marque la contraseña que es 779-328-221. Si quieren ver episodios pasados, los pueden buscar aquí en nuestro Facebook en la sección de videos y también en YouTube. All right, now I'll go ahead and pass it over to the moderator of the day who will introduce today's topic.
Hi everyone, my name is Marlene Zaran and I am the I'm the public health coordinator. Still mess that up sometimes. That being said, today is the COVID-19 day. We do have some updates for you guys, but before I get into that, I want you all to check out our translation line that we have all of the information for in the comment section. You can go to you can call 646-749-3122, and then you put in a code that is 779-328-221. It'll take you right to our translator that we have, Miranda, and she will be translating everything that I'm saying into Spanish. So that being said, I just want to say that all of our videos are posted on Facebook and on YouTube, so you can check those out on our Facebook and YouTube pages. And you can also complete our SOC survey that we have. So we'd love for you guys to complete a survey that we have that kind of lets us know how we're doing and what we need to add or fix for the forum. So that being said, I have a video for you guys for today, and it's a really awesome video that talks all about COVID information through the Department of Health Services. Governor Evers gave a update along with Jennifer, who is also the Secretary of State for the Department of Health Services. So she's on the video as well, and they're going to be talking about COVID numbers, COVID vaccine numbers, and how Wisconsin is doing right now.
Wisconsin continues to be a leader, not only in the Midwest, but across the nation, getting available shots and arms. And as of this weekend, we were once again #1 across the country in using our available supply. That means we're getting more of our doses and arms faster than any other state. So far, more than 2.7 million doses have been administered statewide, with more than 29% of Wisconsinites having received their first dose, and more than 50% of our folks over the age of 65 are fully vaccinated. And this weekend, we crossed a major milestone in our state with more than 1 million people fully vaccinated. Wisconsin, that's huge. We could fill Lambeau Field about 12 times over, and I couldn't be prouder of Wisconsinites. The community leaders, public health officials, healthcare providers, state employees, private partners, and businesses, and so many more who are getting this done. And while we still have a heck of a long way to go to get everybody vaccinated, every day we are closer than yesterday to getting back to our Wisconsin way of life. I know I've said it before, but folks, it's the truth. So far, we have had record days in distribution, including our single day record last Wednesday of 73,114 vaccine doses administered in a single day, with more than a third of those shots completing a vaccine series, either with Moderna, Pfizer, or Johnson & Johnson. We continue to expand and grow our vaccine infrastructure with our next community vaccination site opening in Wausau next week. Now, I visited vaccine sites from Janesville to La Crosse to Green Bay, and our vaccine providers are as ready and eager to give shots as Wisconsinites are to get them. And the best news is that our supply continues to be steady. We're confident in our supply. We're confident in our vaccine providers, and we are confident in Wisconsinites. That's why I'm thrilled today to announce that we will be moving up eligibility to the general public starting on April 5th. That means starting next week, everyone over the age of 16 will be eligible for the vaccine. Now, it won't all happen at once, but I know I'm not alone in feeling the hope, excitement, and relief that we all have anxiously awaited for this year. Wisconsinites should visit the DHS website at dhs.wi.gov to learn more about how and where you can get vaccines in your communities. Remember, supply is still limited, so please be patient and be kind to our vaccine providers. Believe me, they want to get you signed up and get shots in your arms just as much as you want to get them, and they are working tirelessly to do so. Everybody who wants the vaccine will get the vaccine. In the meantime, it's important to remember that there's more than hope and spring weather in the air. This pandemic is not over. Last week, we saw a rise in our 7-day average of new COVID-19 cases for the first time in 3 weeks. And in just the last 5 days, more than 2,000 Wisconsinites have tested positive for COVID-19. Also, just last week, we detected another new variant of the virus called P1 in the state. So folks, don't give up now. Don't let the COVID-19 fatigue get the best of you when we are this close to the finish line. With eligibility opening up to all Wisconsinites next week, and especially with the holiday weekend upon us, we need folks to be as diligent as ever. Whether you're vaccinated or not, continue to wear your mask whenever you and wherever you go out. Practice social distancing, and remember outdoors with lots of fresh air is better than being indoors with others. Avoid gatherings with multiple households, and follow all CDC guidelines and recommendations. We can beat this virus, but we've got to do it together. So let's hang in there and let's get through this spring safely so that we can get back to Wisconsin as we know and love this summer. With that, I will now turn things over to DHS Deputy Secretary Julie Willems Van Dyke. Julie, it's all yours.
Well, thank you, Governor, and good afternoon, and thank you everyone for joining us. As the Governor just shared, we've reached over 1 million Wisconsin residents who have completed their vaccine series. To be exact, 1,013,613 residents have completed their series. We've administered 2,753,146 doses as of today. 75% of our friends and neighbors aged 65 and older have received at least one shot, and well over half of them have completed their series. We're making significant progress in our vaccination efforts. Over 345,000 doses administered last week alone, setting a new record for the 7th consecutive week. And over 1 million Wisconsinites have completed the series since mid-December. These are all impressive numbers, and they are only possible because of the hard work and dedication of our vaccinators across the state. Our healthcare providers, our local and tribal health departments, our pharmacy partners, and our community-based clinics. At the start of vaccinations, I called the effort to vaccinate the residents of Wisconsin the most significant public health intervention of our lifetimes. It has been and will continue to be a monumental task, and our vaccinators are up to the challenge. Again, thank you. We continue to add vaccine providers to our network, including more pharmacies to the Federal Pharmacy Partnership Program, including CVS, Hy-Vee, and Costco, as well as many other smaller chains. With more and more locations available to Wisconsinites who are currently eligible, we are continuing to build on our progress and strengthen our effort. One place we've seen significant success as a state is the percentage of our vaccine recipients who complete their series. Remember, for the Johnson & Johnson vaccine, one shot is a completed series, but Moderna and Pfizer both require a second dose for the series to be complete. Wisconsin is a leader in the country in completed series, and that's something to celebrate because a completed series means more effective protection. So let's keep that trend going. And just as a reminder, remember to schedule your second dose right after you receive your first. And if you miss that appointment, call your vaccine provider and set up another one. Yes, we want you to get that second shot on the right day, but at the same time, we want you to make sure you get it. And we need to continue to all do our part, as the governor said, to stop the spread. Spring brings a lot of holidays along with it, holidays that in typical years might involve travel or gathering with family for special meals and traditions, or all of the above. We need to remember that this is not a typical year. I know it's not the message we want to hear, but traveling is still not a safe activity. And gathering for a meal inside should only happen if everyone at the table is fully vaccinated. Keep washing your hands well, keep physically distancing, keep limiting your interactions, and keep wearing a mask when you're out, even if you are fully vaccinated. We need to continue taking these actions that stop the spread precisely because COVID-19 is still very present in our state. We are adding 588 confirmed cases of COVID-19 today, which brings our total to 576,632 people. As the governor said, our 7-day average is increasing, and it is now at 501 cases. We are reporting 11 more deaths, which brings our total number of lives lost to COVID-19 to 6,612 people here in Wisconsin. As we hold these families and loved ones in our hearts, let this be a reminder that we all need to do our part to stop the spread. And as the governor said, stopping the spread is even more important today because last Friday we announced a third variant strain, the P1, which has been identified in our state. With confirmation that all 3 variants are present in Wisconsin, we must increase our efforts to stop the spread by masking up and getting vaccinated as soon as possible, not only to protect ourselves, but to protect our loved ones, our friends, and our coworkers from infection. We have a window of opportunity to prevent further surges and even more potentially dangerous variants. So mask up and get vaccinated, Wisconsin.
All right, that was an awesome briefing. I hope you guys got some really cool numbers about COVID and the COVID-19 vaccine. You can find this video in our comment section. We have the YouTube link for you guys. And the video is called COVID-19 Media Briefing. There's also more questions that come after that are asked by some news reporters that I thought were really interesting. So take a look at those so you can see some of the answers. They might have some of the same questions that you might have about the COVID vaccine right now. So now I would like to play a video with Dr. Arana and one of our coworkers, Gabe. Essentially, this video is about the COVID vaccine and pregnancy.
Hi, everybody. We're here with Dr. Arana from the 16th Street Community Health Clinic, and we're going to be talking today a bit about pregnancy and breastfeeding and COVID and how COVID affects those two things. So thank you, Doctora, for being with us. What do you have to share with us about this topic of pregnancy and breastfeeding with COVID?
Thank you for inviting me. I get this question a lot. If someone is planning on getting pregnant or someone is pregnant, should I get the vaccine or not? And I think best advice is always ask your doctor, right? If you're planning on getting pregnant, you should already have all the expected visits with your doctors. Make sure you're healthy, make sure you're taking your vitamins, and ask your doctor if it's okay to get the vaccine. If you're pregnant, the same. Please keep all your regular visits, the expected prenatal care. And I can share that during the research and studies and volunteers that got the vaccines several months ago, we had people that got pregnant and we are not seeing any complications. Of course, we don't have many years of experience. This is a new vaccine. That's why I encourage you to ask your doctor. But people that got the vaccines got pregnant with no complications. And we know that pregnancy is a time where the body can be more at risk for some infections and complications. So every pregnant woman talking with their doctor need to make a decision based on risk and benefit. For example, if you are a first-line worker, if you are a doctor, a nurse, a medical assistant, and you're pregnant, if you are seeing patients, your risk is there. You can be at some point exposed to COVID-19, so it's much better to get vaccinated. We are seeing several women vaccinated, staff members from our clinic. We don't see any complications, and moms that are pregnant feel confident that that's the best choice because they are healthcare workers. So far, we're having no issues with those patients.
Great. And then what about breastfeeding? What can be affected with breastfeeding?
Well, with breastfeeding, if mom gets vaccinated, she's going to produce antibodies that are going to block that spike protein from functioning, and she's going to have an immune protection for herself. And we also know that the antibodies can go to the baby through the breast milk, and that's immune protection for that baby, not only for COVID-19, but for other viral infections. Mom can transfer immune protection through breast milk to that baby, and that's safe, and that's even an advantage that we see if breast milk is providing more protection for that baby, even better.
Wow, that's amazing. The human body is truly fascinating.
It is, and we again encourage everyone to talk to your doctor about the risks and benefits. I cannot offer you data of years of experience because this is new, but in all the patients that we have seen and people that work with us at the hospitals that are pregnant or breastfeeding, they are all getting vaccinated and they are safe, and their babies are safer because of that.
Awesome. Well, thank you so much for sharing that with us. We're always thankful for your expertise and your information, and we will look forward to having you on another time.
Thank you so much for inviting me.
You guys can check out some of our links that are on the comment section. We have the website for you guys to go to. That is the city.milwaukee.gov/COVIDvax. That website gives you all of the resources you need to register for your COVID vaccine through the Milwaukee Public Health Department, as well as the populations that are currently eligible to get their COVID vaccine. And then we also have another website that is through the Public Health Department called healthymke.com. That is also utilized to help individuals register for the COVID vaccine. You can also go to Hayat Pharmacy Testing and Vaccination Location, which is located on Layton Avenue. You can register to get their COVID test here at Hayat rx.com, which is a really good facility, and they also have walk-ins for your COVID vaccine. So you can go right into their COVID vaccine center and get your first shot if you are 16 and older now. So vaccines are coming in, they're rolling in really fast, and as the governor stated, we are currently at the top of the list for having the most individuals getting vaccinated in the United States. So that is something to look at as, a shining light at the end of the tunnel. So more people are getting vaccinated, which is a really good thing. I do want to quickly talk about our community resource for today. So for today, we are going to be highlighting the 1-year anniversary. So tomorrow we are actually having the 1-year COVID-19 1-year SOC forum anniversary. So you guys can register for that in the link that we've provided in the comments section. So you can definitely register there. We're going to have some great fun, and it's going to be during the SOC 3 o'clock with SOC forum that we have every day. So come on, we're going to highlight some great times that we've had on the SOC forum, all of the great guests that we've had. We're also going to be giving out mental health baskets to those that do register. So if you can go ahead and register in the link that we will be providing in the comment section, that would be great. Our SOC youth, go ahead and register. You can definitely attend as well. And also those that are living on the South Side. So those that do live on the South Side, you will be receiving a mental health basket delivered directly to your door by one of our organizers in the next 2 weeks or so. So those baskets will have a sanitizer, 2 masks, some essential oils, a cucumber facial, and some other goodies for you through Corel Centro. We're going to possibly get some vouchers for them for you guys to utilize their programs and mental health services as well. So yeah, that is what we're going to have the event. It's going to be a little party, so we hope you guys can join us, and we'll be putting in the link shortly. So anything other than that, I feel we are good to go for today, and we hope to see you guys at our event tomorrow. I do want to say that please, do attend the COVID-19 committee that we have coming up, and you can find that information on our Facebook page. So once you attend the COVID-19 committee as well, you can also have access to a lot of other important leadership events that we are going to have coming up and help us with our mask distribution. I'll be talking more about that next week, but I hope everyone has a great day, and now I'll leave you with our survey promo.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take a quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.